Hi, and welcome to the show. Subscribe at kevinmd.com/podcast. Today, we welcome back Yemi Famuyiwa. She's a fertility specialist. She has a new book, The Quest for Fertility. And there's an excerpt on that book from Kevin MD titled, What No One Tells You About Fertility from a Doctor. Yemi, welcome back to the show.
Thank you. Thank you so much for having me.
All right, congratulations on your new book. And of course, we'll be talking about that. But let's start by jumping into the excerpt that you shared with us. Why did you decide to share this particular excerpt on Kevin MD?
Right. So I think that before we jump into the thick of it, like before you start talking about, because when people think about fertility treatment, they're like, oh my gosh, needles and blood drawers and ultrasound and IVF, and they just get so emotionally overwhelmed even before they need it. So just a little quiet, a little start off to put things in perspective. Same thing I start with all my patients. So patients need that little quiet, that little perspective. And that's why I thought that would be a good place to start.
So tell us what patients should do and what families should do
Mhm.
in that period of quiet before they come
Right.
see you or before they get on that journey to
Yes.
fertility. What does that look like?
So for me, I think that before people hit my door, right, they've already tried. They've they've they're starting to feel, oh my gosh, we can't even get pregnant. And
Hmm.
you hear about, teenage pregnancies. They start to feel a loss of identity. There's a little bit of anxiety. There's a little bit of relationship strain. And sometimes their fear just runs amok even before they get to the doctor's office. They are feeling vulnerable.
Hmm.
So a little bit of perspective, a little bit of pause, and saying it's not all that bad. Maybe what you need to do is get some information before you start fearing for the worst. And so even this book really is my gift to young women and to men for what you should know before things even get, to the point where you're getting to a fertility office.
Now, of course, aside from reading your book, just
Mhm.
give us the highlights of what you wish people and patients understood before trying to conceive.
I think that what people need to understand is just the basics of just getting to know your biology first. Just because we're taught about, I don't think we're taught how to prevent pregnancy. We're taught about STDs and all that, but no one's really teaching you how you can learn how your body goes when you're talking about fertility.
Hmm.
Just getting some knowledge of that and seeing how can you use that knowledge to improve your chances of fertility.
And is it a misconception that you find that a lot of patients believe that pregnancy should happen automatically?
Isn't that something? A lot of people just automatically assume that whenever they're ready, they should automatically get pregnant.
Hmm.
And then, so there's a little bit of disappointment when they're not getting, like, right as soon as they think they should. People are always surprised that, wait a minute, it's not happening right away, and so there's that. I think there's that gap on of understanding that it may not happen right away, right? What are the things you should put in place if you're trying to conceive? Where should you understand and sort of understand your whole body? What
Hmm.
do you need to know if you're trying to get pregnant before things get really bad? Just sort of putting your knowledge, trying to get better understanding of what's going on. Just simple things that you can do before things get bad.
Now, can you give us a little bit of context in terms of how often it takes longer than expected to conceive? What kind of numbers are we talking about in
So,
terms of the
yeah, yeah,
proportion of the population
yeah.
that find themselves in this situation?
Right. So, most patients that are trying to get pregnant, I would say 20% will conceive within the first year or so.
Okay.
right? First month or two, maybe. Sorry, not year, month or two. But that success is cumulative, right? So you would the cumulative success rate is month over month, right? Then probably I would say within a year, 80% or more people will succeed. So it's going to be those patients that the 10% or so that are not getting pregnant.
Hmm.
So those are the true infertility patients that may need additional workup, may need additional investigation to see what's going on. So I think most people first try to figure out how can you educate your body first? What do you need to know? Most people don't even know that, for instance, the egg ages. That most people don't really understand that. They don't understand that as you get older, your eggs may get older. So you see a lot of professional women who think that they will stay fertile forever and a day. And it's always a surprise when they find out
Hmm.
at 44 or 45, they cannot get pregnant because they thought it was always easy.
Yeah.
They don't know that the egg ages. So it's not just a matter of the egg quantity going down, but the egg quality also goes down. So most people really don't know that. And I'm talking well-educated women, has nothing to do with educational level. They just don't know.
Yeah.
And it takes someone saying, hey, listen, let me explain the whole biology of fertility before it gets worse.
So it sounds like this education is needed to
Yeah,
manage pretty much expectations, right?
exactly.
Because if they go in not having this education
Yes,
and expecting one thing and getting another,
exactly.
that can really affect patients. And you alluded to this earlier, but it also strains the relationship as well.
Yes, it does strain people's relationship. You know, the whole idea is to move the fertility conversation from intervention to prevention, right? And the only way you can do that is if you know what's impacting your body now that you had no clue.
Mhm.
So that I would stop getting patients who are 45 years old and they just never knew that those changes will impact them in the future. They simply had no idea.
So assuming that a lot of patients, like you said,
Mm.
don't have education when it comes to fertility,
Right.
when they come and see you for the first time, just
Yes.
walk us through what that initial visit is like with you.
So that initial visit is going to be okay. Let's do the basics. Let's check your hormones that control your ovaries. Those hormones are typically evaluated on the second or third day of your menstrual cycle, right? So you want to check the hormones that may control your menstrual cycle. You want to do a basic thing like having your semen analysis checked, right? If you check it sooner rather than later, then you will know if you have diseases such as abnormal sperm count, right?
Mhm.
Oligospermia, we call it, or decreased motility. And by the way, some of those findings with men may actually it may give you a hint that this man may have chronic diseases,
Mhm.
right? Such as diabetes or liver enzyme problems or high blood pressure. Those things actually have a secondary effect on the sperm. So a lot of times, just by evaluating the men, I'm able to catch chronic diseases that they would have missed if they hadn't gone to see someone, right? So, what do people need to know? You got to evaluate the woman, you got to evaluate the man at the same time together. There are certain factors in your environment that you need to be aware of that may affect your fertility. Prevention is always better than trying to fix it.
How much time do you spend managing patients' anxiety? Because I know that this is a very anxious time for
Yes,
patients when they come see you. And how much
yes.
time do you spend in terms of what to expect during the fertility journey?
I I what I've narrowed down to is I've prepared video tutorials where I go into detail. So I work my patients in a stepwise fashion. Right. What are they expected to see when they first encounter the clinic? What are the things they expect to see when we talk about not even medication, but what kind of workup are they going to expect to get? What's involved in that? So I find that then I before I even do that, I do a whole if I'm constantly teaching them what the ovary is, what the uterus is, how this egg comes out, where sperm goes in, how does it fertilize the embryo, and then the division of the embryo, how does it implant in the uterus. So I noticed that I used to spend about 30 minutes just teaching biology. 30 minutes before I even get to the fertility part.
Hmm.
So what I now do is I have created several mini videos in great detail. And I make it mini so that I don't bore people to death. But I ask them to please watch this video before we get started,
Hmm.
because this is a lot of education that I have to do if I want these patients to be able to benefit from my help. They need to know why, they need to understand the biology before we can move forward. So I find it very instrumental teaching them. And when I noticed that I spent 30 minutes out of 1 hour just teaching that biology, I moved it to videos where I go into real detailed videos on both the egg and a separate detailed video on the sperm. And then I send that to my patients before we even get started. I say, please do me a favor, watch this series of videos. It will help you understand what we're trying to do. So I do spend a good amount of my time just educating.
It sounds like the message that I'm hearing is that if a couple thinks they may be infertile, there's a
Yeah,
bridge, of course, a bridge of education before they come see you, right? Whether it's
absolutely.
videos or reading
Yeah,
your book, it's
yeah,
that education that of knowing what to expect and understanding the biology that can make this journey a little bit easier for them.
exactly. You hit it on the head. It's a lot of educating and gradually explaining this in a simple fashion. So my book is my gift of knowledge to my patients. This is where you start. You can really break down the understanding, remove the element of fear, and then it no longer sounds hard, or it's not as bad if you get understanding first.
So we talked about the education component. So
Yes,
now for those reading your book,
yes.
tell us some of the other key messages that you would like them to come away with.
Oh, so a lot of thing I do a lot of myth busting in my book. For instance, in my book, I dedicate two separate sections to the supplements that people get. Like, everybody's talking about, I want to use that supplement, and I found this on Instagram, and I found that on TikTok. So I actually explain what are those supplements doing? What is the mechanism? Which one is safe and which one is so a lot of people don't know that there are certain things that are harmful. So my job is to I dedicate actually two sections,
Hmm.
one on nutrition, one on the supplements, because everybody has heard of so-called supplements. And also I talk about which supplements may benefit certain disease conditions, such as PCO. Which
Hmm.
one? Well, now called PMOS. Which one will be better for that condition versus just a general supplement. So that I created as a sort of appendix
Hmm.
that people can constantly reference and pull it at any time.
So give us a little bit of a sneak preview in terms of what are some of the most common myths that you want disproved.
Sure. The most common one is it's always a woman's problem,
Okay.
right? It's not. It's 50% men. And then just as women need evaluation, men also need evaluation. And then I also get some people say, well, I thought I'd just start with me first and then we'll go work up my partner later. No, don't do that. Work both people up at the same time.
Hmm.
Because if you wait, you may just simply be delaying, right? It may take you a month to get one person worked up, and then you move on to the next person and find out that there are serious issues. So that just throws in more delay. So fertility is not women only, it's 50% men. Delaying workup of either partner can delay the whole treatment cycle and can have significant consequences.
And just to give us some context, what percentage of infertility issues are solely due to the man?
50%, 50-50. Equal opportunity striker.
We're talking to Yemi Famuyiwa. She's a fertility specialist and author of the book, The Quest for
Yes, the
Fertility.
best for
Today's Kevin MD
fertility.
article is What No One Tells You About Fertility from a Doctor. Yemi, as always, will end with some take-home messages they want to leave with the Kevin MD audience.
Please get information as soon as you can. It's not all scary. So if you just simply understood your biology a little better, it removes the fear factor.
Yemi, as always, thank you so much for sharing
Thank
your
you.
perspective and insight. Thanks again for coming back on the
I
show.
appreciate it. Thank you so much.